Hello, and welcome to today's webinar, A Roadmap for the Newly Diagnosed, Building Your Healthcare Team. Thank you for joining us this evening. My name is Nikki, and I'll be your operator for the presentation today. Before we get started, I would like to take a moment to share with you a few features of the webinar platform. For this webinar, attendees will be in a listen-only mode. At any time, you may adjust your audio using any computer volume settings that you may have. If you need technical assistance, please submit your request under the Tech Support tab in the window on the right-hand side of your computer screen. If you wish to submit a question during the presentation, please use the Q&A window on the right-hand side of your computer screen. Once you type your question, please be sure to press Enter to submit your question. We'll try to answer these during the Q&A portion of the webinar, but if an in-depth answer is needed or we run out of time, we'll try to answer it at a later time via email. We do capture all questions. We're joined today by our moderator, Rebecca King from the Multiple Sclerosis Association of America, and our speakers, Dr. Barry Hendin and Sherrie. At this time, I'd like to turn the microphone over to our moderator, Rebecca, for opening remarks.
Hello, and welcome to the Multiple Sclerosis Association of America's second webinar of a three-part series titled A Roadmap for the Newly Diagnosed, a series focused on helping newly diagnosed patients and their care partners with navigating the beginning of their MS journey. We would like to thank our sponsors, Biogen, Genentech, and Bristol Myers Squibb, as well as our two incredible speakers joining us tonight, MSAA's Chief Medical Officer, Dr. Barry Hendin, and Sherrie from beautiful, sunny Hollywood, California. Before I introduce them, we have a few quick reminders for you. As you may or may not know, MSAA is a national nonprofit dedicated to improving lives today for the MS community. In fact, we have been an MS advocacy organization for over 50 years and provide a comprehensive list of free services, including, but not limited to, a national helpline, equipment and cooling products, MRI funding, an online community, educational webinars such as this one, and much, much more. I highly recommend that you visit our website to experience our new COVID-19 and MS Pathfinder tool, which provides ongoing updates and resources during the coronavirus pandemic. I can personally attest that being a part of the MSAA family, we are remaining vigilant in helping your family get access to the information and resources they need during these challenging times. With that, I should also remind you that we have expanded our helpline hours to 8 p.m. Eastern between Mondays and Thursdays. And of course, you can always access this information and learn more about our programs and services at our website, mymsaa.org. During this evening's presentation, we'll be exploring different strategies on how to build your healthcare team, maybe for the first time, tips and tricks on preparing for various medical appointments, and an overview of terminology that is frequently used in the MS community, as well as common treatment plans you might hear about. I'm Rebecca King, Director of Education and Healthcare Relations, and I have great pleasure of being your host tonight. Please know that a recording of this presentation will be available in our video library next week. And one last item, please take 30 seconds to respond to a short survey that will appear immediately at the end. These surveys really help us in making sure that we give you the right programs at the right time. For tonight's main feature, and without further ado, I'm very excited to introduce Dr. Hendin and Sherrie. Dr. Barry Hendin is a highly accomplished neurologist who specializes in MS. He is the Chief Medical Officer for the Multiple Sclerosis Association of America and has spoken at several of MSAA's educational programs. Over 45 years as a neurologist with Phoenix Neurological Associates, Dr. Hendin is now director of the newly created MS Center of Arizona. He also holds the position of director of the MS Clinic at Banner University Medical Center and is a clinical professor of neurology at the University of Arizona Medical School. Dr. Hendin earned his undergraduate degree at Washington University and his medical doctorate degree at Washington University Medical School. To date, he has had more than 15 clinical appointments to various medical facilities, many of which are at Good Samaritan Hospital, where he served as Chief of Neurology for 35 years. He has had 7 academic appointments, largely at Washington University Medical School and Arizona Medical School. He has also been appointed to nearly 30 councils, committees, board of directors, and a task force, all in the fields of medicine, patient care, education, and research. It is not surprising that more than a dozen honors and awards have been presented to Dr. Hendin, including several for his outstanding work as a teacher. But despite all of his amazing accomplishments, he's extremely humble and fantastic to speak to. He is truly a gem for MSAA, and we're incredibly thankful for his leadership. What's unique about tonight's program is that we have the special opportunity to hear from Sherrie, a member of the MS community. It definitely doesn't take long in conversation with her to realize just how passionate she is about helping other people living with MS live up to their fullest life potential. A quick fun fact is that she actually reached out to us before we even had this program up and running, and the timing for her involvement couldn't have been more perfect. So Dr. Hendin, I will now pass this over to you.
Thank you, Rebecca, and thank you for a very kind introduction. I like the emphasis of the first slide, which begins with "it takes a village." And so often one thinks of the connection with a MS clinician as being the connection they have with their neurologist. This really emphasizes the fact that that neurologist should be the center of a team, and that it takes more than one person to deliver best care over the continuum of the lifetime of a person with MS. So I always want to know that whoever I'm seeing as an MS neurologist also has an excellent primary care physician, often a family practitioner or internist, who's watching over the comorbidities that can play such an important role. If there's diabetes, if there's hypertension, if there are other medical issues, and generally watching over the general health. General health matters in MS just as it does in the rest of the population, and has an influence on outcomes. Obviously, next we speak about a neurologist, but that neurologist we would hope would be a neurologist with a special interest in MS, because although neurologists in general are trained to deal with MS, it's become increasingly complex and sufficiently complex that I think you do want to ask the question, does my neurologist really understand MS specifically? And then the other team members who become very important are the nurses, nurse practitioners, physician's assistants. Care is delivered in an office increasingly by a team that is not just the neurologist, but the nurse practitioner with special interest in MS, the PA with special interest in MS, the nurse, the MA, the medical assistant. All of these people are quite important. And then in one journey with MS, it may be that one spends a life needing few of the additional specialties that we rely on. But I can tell you that individual patients in my practice, individual people with MS, will often find themselves having other issues, and I will want to have a team around me that understands MS. So sometimes that's the other clinicians, that maybe the urologists deal with urgency or frequency of bladder function that can occur in the course of MS. That may be the psychiatrist or psychologist who deals with the anxiety or depression or life changes that can so often be part of MS. That may mean the physiatrist, the physical medicine rehabilitation physician, who outlines a program of rehabilitation when there are neurological deficits, weakness, walking difficulties, etc. And part of that team, and that is the physical medicine team, the physical therapist, the occupational therapist. I think that sometimes difficult to define the exact role of how an occupational therapist differs from a physical therapist. I think that they sometimes blend, but I often think of the physical therapist dealing with more of the issues of gait and lower extremity function, mobility, strengthening, sometimes the need for assistive devices, be that wheelchair or braces or orthotics. The occupational therapist often dealing with upper extremity and functional issues, things that could reflect coordination of hands, safety of the house, how to modify the environment to make it easier to do what you do. The team lists additionally social worker, and I will tell you that for some people, the social worker has been really, really an essential part of our team, finding resources when employment is an issue, when housing is an issue, when insurance is an issue, when just financial difficulties become an issue. What I'm trying to say, and I think what this slide together says, is for somebody with MS, the journey may be primarily about their primary physician, their neurologist team, their nurse practitioner, but you want to know the availability of others for special needs which you uniquely may have at a time when you have it. The one I didn't mention, which is about wellness, is dietitian, exercise physiologist, to make sure that we maintain as part of our vigilance, the vigilance about just general wellness. We understand that outcomes, and that means preventing disability, reducing the likelihood of disability, is not just about maintaining good neurological health, but good general health and wellness. None of that should be neglected. So we've talked about everybody else. Let's circle back to talking about neurologists. And Sherrie, if you don't mind, this slide talks about finding the right doctor, the right neurologist. Would you give your thoughts about what are the characteristics that make you comfortable that you found the right neurologist? You could also mention what makes you pretty sure you found the wrong one.
My opinion is a doctor that you feel can hear you, and that if you have questions, they are willing to answer those questions, even if it means they need to do some research. If you're dealing with just a neurologist, and let that neurologist say to you, well, I'd like to send you to an MS specialist because they have more knowledge about the current medications that are available to you. So that, in general, is the main thing. We all want to be heard, and we need to have somebody in our corner that understands what we're trying to explain to them and don't belittle us and say it's not all that important. It's all very important to us as a patient. So the first thing you need to find is a doctor who hears you. They don't play you to the side. You're just making a lot out of nothing. That's the most important thing. You have to have confidence in the team that you set up. So having a doctor with a good bedside manner, as it said, is extremely important to us, to have that confidence in building our village.
Thank you, Sherrie. I think those things are, in fact, exactly as you say, very important. And you're stressing communication and concern for you as an individual, understanding that what is relevant to you is relevant. The slide also says a couple other things. One is, I don't feel rushed. It is unfortunately part of current medicine often to have a very crowded schedule. And I think it's fair to say that you would like to have at least sufficient time spent with you to deal with the issues that you've got in front of you. Doctors have variable amount of time. The doctor will use that time more or less efficiently, but you shouldn't feel rushed. You should feel that the focus you brought into the visit is answered, that you're being listened to, and that the doctor knows what is important to you. The question then is, when you're looking for a new doctor or an MS doctor, what are you kind of looking for? And here, there are a lot of ways people find their neurologist. And I've got to say, periodically I ask patients, how did you find me? And it's by a lot of different resources. Sometimes it is the recommendation of another patient. Sometimes it is the recommendation of their primary physician. Sometimes it is because their insurance prohibited them from seeing somebody else, but my insurance matched theirs. Sometimes it's because I'm close and not so very far away. But in terms of trying to select the right doctor, it's not that there is one resource available to do so. There are online resources that allow you to find out who's interested in MS and at least what their patient experiences have been. Often it is the connection to your primary doc because your primary doc is going to be working with that neurologist. And so it's nice to know that there is a line of communication. I think it's a really important connection, and that is the likelihood that your primary doctor, primary clinician will say, I'm referring you to Dr. So-and-so because I work with him or her, and they do know MS, they do know what they're doing, and we have a good line of communication. But a lot of times it is, my sister-in-law saw so-and-so, My sister-in-law had a good experience or bad experience. My cousin, my friend, I just got a referral the other day because patient's anesthetician was also a patient. So it can be from various places. But I will tell you that when I first see a patient, for the very first time, I tell them that I believe they're interviewing me and that they should be asking themselves, is this a comfortable relationship? Am I the right match for them? It isn't always so, and they should be very upfront about both asking themselves, is this the practice I want to be in? Is this a clinician I want to connect to? Am I comfortable here? And I tell my patients when I've seen them for the first time, if it's a match, and it usually is, then great. But if it were not by chance, that they should feel free to tell me and that I am their advocate in finding the right match for them. Hopefully, one has a good enough research experience to make it a good first match. Sherrie, what are your thoughts on your first visit to your neurologist? What you're looking for, what you're asking?
The biggest fear that I find with patients that are early diagnosed is fear. The only way you are able to combat fear is with information. When someone gives you information, well, this is what you do here, this is what you might look at here, and exactly, you're going to interview them, you're going to ask them, how long am I expected to be in a visit with you? If your answer is 20 minutes, then that's not someone you possibly want to deal with because there's many, many questions that you're going to have to ask, and they have to be answered, and you must be comfortable. As a woman, because there may be issues with UTI and bladder issues, are you more comfortable with a man or are you more comfortable with a woman? So you have to ask yourself the things that are important to you while you are building your team. And we all know anxiety is our biggest enemy. So it's not good for us to be rushed trying to do something because we're always going to forget something. Oh, I meant to ask that. I meant to ask this. I tell people all the time, get into keeping a pocket calendar in your purse so that you can take it out at any time. Oh, I have a doctor's appointment coming up. Oh, I have to pick up this medication. Oh, I meant to ask this question. Write it down. Keep it with you at all times so that you can take it to wherever you need to go and you don't forget something, which is especially if you're dealing with something, any kind of medication that has made you sleepy or made you forgetful or whatever it is. Always write it down. It's hard to keep unless you're one that keeps a phone on you all the time. You can enter it into your phone. I'm old school, so I believe in writing things down. So you have to interview your doctor. Dr. Berry is absolutely correct. They want to keep you as a patient. They like you or they're interested in you. They always want to know, what do you like to do? What brings you joy? So all these different things. If you find a doctor who's a neurologist that maybe has a background too in psychology, that's a perfect match because they understand that, these things are affecting your mind as well as your body.
So you emphasized a bunch of things, and I kind of follow up and agree. Number one, I think people with MS come in with multiple issues. Most neurologists know that MS takes more time than other aspects of their neurological care. And I think part of what you're saying is you don't want to feel rushed. You want to know that there's time enough to deal with your issues, that you want to know the person you're talking to is someone you're comfortable with. And that may be on a lot of different levels. That maybe can include gender or age or just how a person behaves and thinks. I think it also should include what your experience with MS. Are you comfortable with MS? Because not every neurologist feels comfortable with MS. You want to be in a place where, at the very minimum, there is a comfort level with MS and all the changing medications and thinking about MS. At the most, a real MS subspecialty. And then the question, which Sherrie, I think, has answered, and the reflection is, for yourselves, how did you feel when you left in the midst of your first visit or second visit or third visit with this physician? How did it feel when you walked away? Was it a good experience? Did you feel comfortable? Did you want to return? And then additional reflections, would you have felt free to talk about all issues? This mentioned some biologic, and that is bladder issues, sexual health. But I would add, for me, it often comes up, I think just as Sherrie mentioned, human issues. What are your relationships? How are they going? What's your life like right now? What about your job? Has it changed? So it's more than just tell me about your disease-modifying therapy, tell me about the relapse. It's also, I think, a time to reflect on whether you can, in fact, talk about real life. Sherrie, I think you began talking a little bit about how you keep track of medical information. I think you've given us at least a pre-look at that. Would you like to talk about the tips you have for how to keep track of medical information?
Well, the first tip, always start out just for your life as well as medical information. If you want to I keep journals. I have since I was a teenager. So that I have a medical journal that I come back and I look at and I write, how did I feel about this appointment? Do I feel the information I received was wonderful and that it's helping me? For my personal things, not to forget things, I keep a pocket calendar in my purse at all times. It's too easy to forget things that might come up again, even if it's a question. I was here and I was having this issue coming along. Is this expected or is this something that medication can help me with? Whatever it is, always keep that with you. So because this is something, anything that comes up in your head you don't know. You might meet somebody like me that has MS and has been in the battle for 25 years. And you may have questions for me. When you run into people like that or you know you're coming across people like that that might have some answers for you that you've never even thought of. When you possibly get to the point to where you do need to use a cane, where you do need to use a wheelchair or you may need to use a scooter or wherever that is, you may have questions about how do I do this? How do I get from A to B to C? And you have to have an understanding that you still can do it. You may have to do it in a different manner.
That leads us to our next slide perfectly, and that is counseling and finding the right therapist, including a psychotherapist. So you bring up, I think, the fact correctly that depression is more frequent in people with MS. Anxiety is more frequent in people with MS. It's not just about life circumstances. It probably relates to the biology of multiple sclerosis. So it's both a biologic and also a matter of probably circumstances and difficulties or obstacles that are faced by people with MS. And so the question is, should you see someone? And if you should see someone, who should it be? I've got to tell you that I have a particularly low threshold to call in psychologists and psychiatrists. I happen to have a particularly advantageous set of resources around me. I have 3 daughters. One's a psychologist, one's a psychiatrist, and one's an neurologist. So I have a fair amount of resource around me. But what it reminds me is I do make referrals at a low threshold. I frequently ask about depression. I frequently ask about anxiety. I think sometimes I hear it and see it before the person in front of me wants to talk about it. I have a low threshold for recommending psychiatry and psychology. If someone wants to understand the difference, psychiatrists can prescribe medications and often have a limited amount of time in terms of the talk therapy and a fair amount of time for the medicinal therapy. The psychologist does not prescribe medications and often spends more time in the talking and counseling aspects of mental health. I've got to say, not all psychologists or psychiatrists are equally familiar with MS, and so if there is a psychologist or psychiatrist who is familiar with MS, all the better. Again, in my own community, I have the advantage of having a daughter who is a PhD MD in psychiatry and psychology, but she knows MS, and because probably 20% of her practice is MS. But I also know the people in my city who aren't just excellent psychiatrists or psychologists, but who for one reason or another are familiar with MS particularly. So I gravitate not just to the excellent psychologists or excellent psychiatrists, but to those people who are humanistically the people I want, but also who may know a little bit more about MS. And your point is correct, and that is psychology, psychiatry, not for every patient, not for every person, but for many, is a crucial link at times when the human aspects, the situational aspects, or depression or anxiety can weigh so heavily. And then the next question that comes up is, The question of when you get any specialist, be that neurologist or urologist or psychiatrist or psychologist, is your insurance match? It isn't always so. Do they have experience treating this? How do they feel about medications? How do they feel about non-pharmacologic treatment? And that is, how do they feel about the aspects of treating anxiety and depression that can be talked through or dealt with by non-medicinal interventions? And do they work with others, and including the ability to work both face-to-face and by teletherapy or increasingly virtual care? So those are the thoughts I have. How do you find the right one? You ask your primary doc, you ask your neurologist, you ask your MS neurologist, and as always, they've got to have insurance coverage with you, ideally, and your friends or support group may be able to help you too. Preparing for appointments. Sherrie, would you take over?
I feel if you're preparing for appointments, always make sure, as far as your time schedule, make sure that it's a time schedule where you're not rushing to make sure you make that appointment. Making sure that it fits into your day, not fits into their day. You have to make sure that it's a time schedule that works well for you. So make sure you're prepared, have your daily calendar in your bag, and when you go in, because you'll have another appointment that will be scheduled for you with that doctor again, or maybe there's another physician that he thinks you might like to be seen dealing, because depending on what's going on with your body, you might have to be referred to a urologist because you're having multiple UTIs. He might want you to see or want you to think about seeing a counselor of some kind because you're having a very hard emotional time. So that all takes up time in a schedule. If it's a new doctor that you're seeing, always think about that fact. How can I talk to you in 20 minutes? You need to ask the people at the front desk, am I able to book a longer period of time if I want to be seen by the physician at least an hour? See if you can do that. Some things are within your grasp, and all you need to do is ask.
Sherrie, do you come in with written questions, or do you just do them ad hoc? Sort of when you're there, try to remember what you're interested in. Do you keep notes? In advance of going in, you write down questions.
To see a new doctor, yes, I do. Yes,
what about
I do.
Your regular follow-up? Do you keep notes of questions you've got for your follow-ups as well, or primarily new visits?
Follow-ups as well, because something always is possibly going to come up, something that might be new with my body. So yes, I do.
Do you usually have one primary question or a half a dozen little questions?
I usually have probably about 3.
Good. It's good. I think that that's a great strategy, by the way. So I think that there may be one question which is crucial and that you want to make sure that one question gets answered, and I think it helps to have that written down. Maybe 1 or 2 extra that are sort of side questions, but if you kind of write down those that are really central and crucial, you make sure those get answered. Sometimes when there are 36 questions, it's a little harder to get to them, but you made the point correctly that writing down the crucial few is really worthwhile. So I agree entirely. The questions, I suppose, what sorts of questions might you suggest would be important for the first visit with a new clinician, new neurologist?
Do you have any specialties in understanding multiple sclerosis? Because you can always find a neurologist, but when you go to a specialist, you want to make sure that they are a specialist in dealing with your issue. Because if it's just a standard neurologist, they might not have any dealings with an MS person. So they don't know how to react to questions that you might have. They won't know which way to go. You want to be comfortable, especially, like I said, as a woman. I mean, men have their issues, and you're for childbearing age, you're going to have multiple questions about how am I supposed to feel here, what medication is not good for me to be taking at this time because I do wish to be pregnant soon, or whatever that issue. So that would be the time that I probably would want a female physician versus a male. I always, from my own peace of mind, I've always kept journals because then I can discover in my journal, okay, why are you depressed? What are you upset about? What's going on? Because then you can read back.
That a bunch of different questions may exist. But the first time it may be your own unique questions. And so very often, I agree with you, first visits, young women of childbearing age, very often about what medications, well, first of all, what about having children? What about how will that affect my MS or otherwise? What about taking these medications? How will that affect my ability to have children? Will I have to avoid certain medications? Other questions can be things like, do you recommend a specific exercise routine? Do you recommend any specific diet? Your point, on the other hand, is that those questions will vary over time and will vary person to person. Nobody goes in and has the exact same visit experience as the next person. So it might be, what did my MRI show? Can we talk about changes in medication or continuing on this medication? So there's so many questions that are unique. They're general questions about the practice and about MS and about one's own concerns about the future for MS. What will become of me? What can I do to make it more likely that I'll live a life with highest ability, with least disability? But some are unique. What do I do about the exacerbation that I just had? What do I do about medication? What do I do about pregnancy? What do I do about my job? And I think that's the important thing, that we don't have one unique set of questions that everybody will share, that they're all very variable depending upon the individual. But that allows us to go on to disease-modifying therapies, because that's so often central to the treatment of MS. I think the first thing is, how do we define our various therapies? There are now more than 20 disease-modifying therapies. Those are intended very specifically to reduce relapses and to reduce the likelihood of long-term disability. And we generally recommend starting those as early as possible, unless there is some reason, a unique reason not to do so. Which one is chosen is very much a long discussion between the clinician and the person with MS. What's their sense of the medication they want to take? What side effects are they worried about? What are the most effective medications? Is there a rationale for using the most effective medications earliest? I believe there is. What about the risks of each of the medications and the unique risks that might exist for an individual, the side effects that might be of more concern to one individual than another? What about the medications in someone wanting to have a family or during pregnancy? All of those questions. But a central component of virtually all initial discussions is a discussion of disease-modifying therapies. Until 1993, we had 0 disease-modifying therapies, and that meant that if you had MS and saw your neurologist, they weren't going to be able to change the trajectory of your MS. Now we've got more than 20 agents, I'd say about 24 right now, and as such, we have a lot of possibilities about matching the right agent to the right person for both the power that we need and also just the profile of the agent. How often you have to take it, by what means? Is it an injection? Is it a pill? Is it an infusion? Is it a high-powered agent, high efficacy, or less so? All of those are hugely important discussions. What about relapses? Sherrie mentioned relapses and steroids. I would say for the relapse treatment slide, the most commonly used intervention is steroids, either orally or by IV for most relapses. There's sometimes also the use of ACTH instead of steroids, but steroids are the most commonly used. For the most severe episodes, we have the ability of plasma exchange, which requires hospitalization generally. Rehabilitation is something that I would say is not for me a relapse treatment, but rather a treatment for people who have any kind of lingering disability, be that coordination or with walking or with strength, etc. So it's often a part of the regular care of individuals, including recovery from relapse. And then symptom management. So back to physical therapy, that's where I plug this in. I find that anytime there is a relapse with a neurological symptom that persists, that interferes with function, physical therapy, occupational therapy become very important. If there's spasticity, we'll use muscle relax. We have medications for fatigue. We have medications to improve walking. We have medications to improve bladder function, sexual function, anxiety, depression. These are very important interventions to keep quality of life high. So again, the disease-modifying therapies are to reduce the likelihood of disability down the line and increase the likelihood of a life with little disability. But for those people who do experience ongoing problems, be that of fatigue or pain or bladder dysfunction or depression, anxiety, or whatever, using something to treat the symptoms is an important intervention for quality of life.
Can I interject here?
Yes.
I think everybody has their own specific kind of thing that gets them through, and mine is music. So if I'm in a depressive mode or I'm going to that and I can feel it coming on, literally, if I'm able to go somewhere and I can belt out a few tunes, then I come back to being who Sherrie is. It helps if you kind of know who you are, because anything that's attached on somewhere that seems not normal to you, don't put it on yourself, because most MS patients that I've ever met, especially women, have been high achievers in their life. So you have to get to the point to understand, if you have 10 things to do on your schedule for the day and you get 4 done, that was a good day. Don't beat yourself up. Do not do that to yourself. So if you do that, don't expect to get all 10 things done. But dang it, I got 4, almost 5 done. For women, certain things you have to choose to give to MS. If your thing is style, which mine was, and at 5'10", I had the nerve to wear 4-inch heels and go out dancing all night long. And yes, I miss those days. But that sense of style can change to something else. So I have a cane to match any outfit that I wear. And then I used to drive convertibles. So I have 3 scooters, and then I have a friend of mine who's an artist, and so I've made them really, really cute, and they all have names. So you got to keep true to who you are. There are some things that MS will take from us, and we know that. But other things about you and your personality, you have to give that to MS. Don't do that. You have to keep something for yourself to get through.
Sherrie, what you wanted to put in there was something that isn't on our slide set, but is in fact very important. And without that comment, we would be really missing a central ingredient in care of MS. So we talked about disease-modifying therapies, crucial. We talked about the ability to treat a relapse, crucial. We talked about symptomatic meds, crucial. You bring up wellness and the ability uniquely to deal with wellness in your own way. So for you, it's music. And I would say that the breadth of wellness is, are you exercising? Because it's important in MS, at whatever level of ability you have. If you're in a wheelchair, if you're walking around, having some exercise pattern is important. Are you maintaining a good diet, including weight control? Are you maintaining mental health? Are you enjoying those things in your life that are important to you? If it's reading, if it's music, if it's dining out at a good restaurant, those things that make life rewarding. And then staying connected. So staying connected to family, staying connected to friends, staying connected to faith, staying connected to hobbies. Whatever is the place that you get your joy, we need to really not lose the track of the fact that it can't all be done by medications. It has to be done by human aspects, music, or otherwise as part of wellness. So I hugely appreciate that. Thank you. Going back briefly to the medications that we use, the discussion of finding joy and maintaining a life filled with those things that are rewarding, I think, is central. There's a slide on the medications we use. This is a simple slide in a way, and that is we're always looking to see whether the medications we're using are matched to your particular profile. I tend to like more efficacious medications, but sometimes not. Always in discussion with the person in front of me about what their philosophy of treatment is, not just what mine is, but what theirs is too. Sometimes it's increasingly we have discussions about generic medications, their advantages and disadvantages. We don't always have the exact same dosages for all medications. Sometimes we have to personalize those as well. But all of this that we're talking about really speaks to a number of things. One, I believe that it's important to know that MS 2021 has been a better journey for people with MS than MS entering 1990, 1980, when we had no disease-modifying therapies, even 2000 when our therapies were less efficacious. I really believe that someone who is recently diagnosed with MS should know that the likelihood is that their journey with MS will be far more favorable than their fears. Number two, that they need to find a team. That team is centered around a neurologist, but it can't be only the neurologist. It really is a team, and that they need to find the resources in their community to help them as well. As Sherrie pointed out, it's not just the medical team and the medications that we use, but also those things you do for yourself to find joy and to achieve wellness. So those are my primary thoughts. Sherrie, I'm delighted that you could express those very real and important aspects of living a life with MS. And I think I'm now delighted to turn over the phone to any questions that the listeners might have.
Well, thank you so much, Dr. Hendin and Sherrie, for that incredible presentation. And of course, we have many, many questions to go through from the audience. And so, Dr. Hendin, the first one is for you. How should I approach continuity of care if I have to move? I may be moving soon and will be too far away from my current healthcare team. That being said, I really like my current healthcare team.
The nice thing about the MS specialty community is that we are a warm and close-knit national community. So it is highly likely that your neurologist, particularly if it's an MS-focused neurologist, will know who in your next city specializes in or is interested in MS. My first approach, therefore, would be to ask your current team who they know close to the place you're going. If there is no connection to someone close by, then I tend to rely on a number of resources. Number one, the MS Society, MSAA, and others may have a list of the people in their community who know MS and are interested in MS. I often say that in the absence of knowing anything else, the university may have a specialty MS clinic. And so in order, I would first ask my clinician, particularly if it's a good relationship, who they know where you're going. Number two, I would ask the societies, MSAA and others, who they know. And third, if in doubt, I would tend to go to the university, find out who their MS specialist is, and either find myself in care there or ask them who they trust in the community.
Yeah, I think that's a terrific answer. I would be amiss if I didn't also put a plug in for MSAA and all of the resources that we provide. But one of those that we provide that is especially helpful is actually the Helpline. And we have amazing social workers that are trained to manage the Helpline. And so you can call them about literally anything, and they will try to connect you to the right people. The next question, Dr. Hendin, also for you. I currently see a physician that is wonderful, but the office staff that works with the physician is simply difficult to work with. I find myself following up repeatedly to get my lab results and charts sent on to other members of my care team. Should I expect that the office staff will change their ways, or should I look for a new doctor's office? Great question.
It's a difficult question to answer, but I can tell you my approach. My approach would be to speak to the clinician and present the problem. Really, it would go as such. I very much enjoy our relationship, but a large part of how things go depends on your staff. These things have been going wrong. If that can be fixed, I want to stay here. If you think that can't be fixed, can you tell me who you trust for me to go to a place where I can get not just this good human care, but also technical support I need?
Right, absolutely. And someone who has healthcare administration background, that is not an uncommon experience to have, and you should definitely communicate with your provider if you're having issues with the office staff. The next question is, I trust my doctor, but one of the health issues I'm dealing with doesn't seem to be resolving. I'm thinking I might need to see a second opinion. I feel guilty about going to another doctor, but have been dealing with the same symptoms repeatedly.
The answer about second opinions is can be a sensitive issue, but shouldn't be. Certainly when I am asked about a second opinion, my answer always is, yes, let's find another neurologist who knows MS and is sophisticated and a specialist, and we'll see what that neurologist thinks. I will tell you that there are neurologists who are sensitive about second opinions. I will tell you they shouldn't be, and that the sensitivity of the neurologist should be irrelevant. If one needs a second opinion, one should seek a second opinion. It's good for the person with MS. Whether they know it or not, it's also good for the neurologist.
Wow, yeah, that's some terrific insight. And I wish that we could continue this for hours on end. The last question of the night, Sherrie, is actually for you. This patient said, Sherrie, thank you so much for sharing your story. You mentioned that it's important to be prepared for appointments with doctors. What are your thoughts on writing down questions for appointments with other healthcare professionals? I am in physical therapy right now and find that I have questions and updates I want to share at the start of each of my appointments, but don't want to come across as being too formal.
As being too formal? In general, as one that has worked in the medical field for 30 years, you are the patient. They're supposed to answer your questions. Never should you feel anxious about asking for help, especially from someone who's there to help you. There's absolutely nothing wrong. I have a neurologist, I have an MS specialist, I have a physical therapy office. So I have to keep all the appointments straight, hence keeping the pocket calendar on me at all times. But yeah, write down your questions, and if they don't answer your question, then that's an issue. You might have to talk with their management. You need to get your questions answered. And don't feel bad about needing your question answered. It's yours. You need to feel comfortable. You have to be your own best advocate. So in doing that, yeah, you have to, nobody's going to be a bigger advocate for you and how you feel than you. Mm-hmm. So you got to go there. You got questions, ask them. Don't be embarrassed. There's nothing to be embarrassed about.
Yeah, absolutely. They're not going to be able to help you if they don't know what's going on. Right. So, well, I think that was a perfect way to wrap up this presentation. And I would definitely like to thank Dr. Hendin and Sherrie for taking time out of your busy schedule to develop this program with us. You know, what our audience doesn't see is all of the work and the meetings and the focus groups that went in behind these special programs, and so I really appreciate the time that you guys have taken to do this. I would also like to thank our funding sponsors, Biogen, Genentech, and Bristol Myers Squibb. Without them, this program would not be possible. And as mentioned, tonight's webinar will be archived to our website. However, before we let you go and enjoy the rest of your evening, we ask that you take a very brief survey that will immediately show up on your screen after this live. On behalf of MSAA, Dr. Hendin, and the lovely Sherrie, we thank you so much for joining us, and we hope that you have a great night wherever you may be watching. Take care.
Be well.
Thank you.
Sorry about that. That concludes today's presentation. Thank you for joining us. Please follow the prompts to be redirected to the participation evaluation form.